A sign and a symptom are the same thing. They are a feeling felt or experienced by a person who comes to see a doctor for a consultation. It is different from an illness. A sign has two components, subjective and objective. It is subjective because it is reported by the person experiencing it as they feel it. It becomes objective or objectified when, during the physical examination, the physician highlights it, particularly through touch or certain techniques. For example, a fever can be detected by a thermometer, weight loss by weighing, respiratory problems by auscultation, pain by touch, etc. A syndrome is a set of symptoms that occur simultaneously and characterize a particular disease. Syndromes do not necessarily have a single known cause, and their symptoms can vary. For example, fever, weight loss, cough, fatigue, lack of appetite, night sweats, etc. may simultaneously suggest tuberculosis. Diagnosis is, at first, a disease that the doctor is thinking of in presence of signs or syndrome. Note that I say think of because this diagnosis must then be confirmed or refuted later on. In other words, the diagnosis has two successive components. The first is presumption or exclusion, for which the doctor will order laboratory tests and imaging. The second component will be confirmation upon return of the requested results. In our example, the presumptive diagnosis would be tuberculosis until lab tests and imaging confirm it. The disease. Once the results confirm it, we will then speak of a disease, an illness, a condition, or simply a confirmed diagnosis. So, for our example, the disease here will be tuberculosis. Thank you, and see you at the next definition.